A Raleigh Rehab facility was fined more than $30,000 by the state after a man fell out of his bed there and died this summer.
WRAL Investigates has been following this case closely. Sarah Kruger shares a new report now that reveals a staff member's actions are being called into question.
The father of the man who died after a fall here sent me this report he just received from the state. It details what happened that day, piecing together interviews from staff members.
I promised him I would. I promised him I'd find out and I'd get to the bottom of this, no matter what it takes.
When WRAL Investigates spoke this summer with Carl Michaud's dad, who goes by the same name, he told us Raleigh Rehabilitation Center told him his son fell out of bed on his own and later died at the hospital. Immediately, the older Carl Michaud knew that was impossible because his son was quadriplegic, only able to make slight movements of his head.
He didn't fall out of bed. Something happened.
The report from the State Department of Health and Human Services validates his suspicions. It says a nursing assistant was caring for his son and she left him on his right side with the bed at waist height and exited the room to speak with the nurse and obtain supplies. While unattended, he fell off the bed onto his back on the floor, hitting his head, resulting in a hematoma. It was a housekeeper who then found him. The state wrote that Raleigh Rehab failed to keep the facility free of accidents and hazards and ensure each resident receives adequate supervision to prevent accidents. In the state's interview with that nursing assistant, she said the staffing agency for which she worked would not send her back to work at the facility. The man's father believes the nursing assistant shouldn't be allowed to see patients anywhere.
I probably would have a hard time forgiving her because it was my son. And she's the one who has to live with the fact that she did something that caused the person's death.
This report shows that because what happened was an issue of past noncompliance, no plan of correction was required. This shows, though, that the facility did do some extra training with staff members to try to prevent future incidents. Sarah Kruger, WRAL News, Raleigh.
As for the fine imposed by the state's Centers for Medicare and Medicaid Services, documents obtained by WRAL show that was for having, quote, substandard quality of care. The facility was found to be out of compliance the day he died and the 2 days following.